Warning: 4 bathroom habits. Seniors do that. Increase stroke risk by 300%. Your daily bathroom routines might be more dangerous than you think. These 4 habits could significantly increase your stroke risk. Stay with us to learn the most critical habit to change immediately. Straining prolonged. We commence this critical exploration by addressing a bathroom habit so common, particularly among seniors who may experience changes in bowel function, yet so fraught with potential peril for cardiovascular and cerebrovascular health. The act of prolonged and forceful straining during defecation. While a natural bodily function, when the process becomes an arduous struggle, characterized by holding one's breath and bearing down intensely for extended periods, it can trigger a cascade of dangerous physiological responses that significantly elevate the immediate risk of stroke, especially in individuals with pre-existing vulnerabilities such as hypertension, atherosclerosis, or a history of heart issues. This intense straining maneuver is essentially a form of the Valsalva maneuver, where one exhales forcefully against a closed glottis, the airway. This action dramatically increases intrathoracic pressure within the chest cavity, which in turn impedes venous return of blood to the heart. Consequently, cardiac output, the amount of blood pumped by the heart, temporarily decreases, leading to a transient drop in blood pressure. However, and this is crucial, when the strain is released, there is a sudden surge in venous return and a subsequent rapid overshoot in blood pressure, sometimes to dangerously high levels. For a senior whose arteries may already be stiffened by age or narrowed by atherosclerotic plaques, or whose blood pressure is already elevated or poorly controlled, this abrupt and dramatic fluctuation in blood pressure can be catastrophic. The sudden spike can place immense stress on the delicate blood vessels in the brain, potentially causing a weakened vessel wall to rupture, leading to a hemorrhagic stroke, bleeding in the brain. Alternatively, the hemodynamic shifts and turbulence created can dislodge an existing blood clot, thrombus, from an artery, which can then travel to the brain and block a cerebral artery, causing an ischemic stroke due to blockage. This risk is not hypothetical. Medical literature contains numerous accounts of strokes occurring during or immediately after episodes of intense straining. The danger is compounded by the fact that constipation, a primary reason for such straining, is a common issue among seniors, often due to factors like reduced physical activity, inadequate fiber and fluid intake, side effects of medications, or underlying medical conditions. The daily habit of sitting on the toilet for prolonged periods, repeatedly and forcefully bearing down, is akin to playing a dangerous game of physiological roulette. It creates sharp peaks and valleys in blood pressure and heart rate, placing the entire cardiovascular system under extreme duress. The increased pressure is not just felt in the abdomen, but is transmitted throughout the vascular tree, including the carotid arteries supplying the brain and the cerebral arteries themselves. Moreover, this straining can also increase the risk of cardiac arrhythmias, irregular heartbeats, such as atrial fibrillation, which is itself a major independent risk factor for stroke because it can lead to the formation of blood clots in the heart that can then travel to the brain. The earnest plea here is to recognize the profound danger of this habit. It is not a sign of weakness to seek solutions for constipation, but an act of profound wisdom and self-preservation. Addressing the root causes of difficult bowel movements through dietary changes, increasing fiber and fluid, appropriate physical activity, and consultation with a healthcare provider about safe and effective strategies to promote regular, effortless elimination is paramount. Techniques such as using a footstool to elevate the feet during defecation, which helps to straighten the anorectal angle, making elimination easier, avoiding prolonged sitting on the toilet. If no urge is present, get up and try again later, and learning to breathe deeply and relax the pelvic floor rather than forcefully bearing down are crucial modifications. Ignoring chronic constipation and resorting to daily prolonged straining is a high-stakes gamble with your cerebrovascular health. The goal should be a smooth, easy bowel movement that does not require heroic effort or breath holding, thereby protecting your brain from these dangerous hemodynamic shifts. Sudden temperature. Let us now turn our attention to another seemingly innocuous yet potentially hazardous bathroom habit: especially pertinent for seniors whose bodies may be more sensitive to abrupt environmental changes. Experiencing sudden and extreme temperature shifts, particularly from a very hot bath or shower to a much cooler ambient room temperature, or vice versa. While a warm bath can be relaxing, the physiological adjustments the body must make to rapid changes in external temperature can place a significant, albeit often unnoticed, stress on the cardiovascular system, which in turn can precipitate conditions conducive to a stroke. When an older individual immerses themselves in very hot water for an extended period, peripheral vasodilation occurs. The blood vessels in the skin and extremities widen significantly to help dissipate heat. This widening of the blood vessels can lead to a drop in blood pressure, sometimes quite suddenly, as the same volume of blood is now circulating through a much larger vascular space. For a senior who may already have borderline low blood pressure, orthostatic hypotension, or whose autonomic nervous system, which regulates blood pressure, is less responsive due to age or underlying conditions, this can cause dizziness, lightheadedness, or even fainting upon standing up or exiting the hot bath. This is a dangerous situation in itself due to the risk of falls and injury. However, the cardiovascular stress doesn't end there. When the individual then moves from this very warm, vasodilated state into a significantly cooler bathroom environment, the body attempts to conserve heat by causing peripheral vasoconstriction. The blood vessels in the skin and extremities narrow rapidly. This sudden constriction, coupled with the body's attempt to normalize the previously lowered blood pressure, can lead to a sharp, sometimes dramatic increase in blood pressure. This abrupt spike in blood pressure, much like the one experienced after straining, can place immense stress on the arterial walls throughout the body, including the delicate vessels in the brain. If there are pre-existing weaknesses in these vessels, aneurysms, or significant atherosclerotic plaques, this sudden hypertensive surge can trigger a rupture, hemorrhagic stroke, or dislodge a clot, leading to an ischemic stroke. The opposite scenario, for instance, stepping into an overly cold shower on a hot day or moving from a warm bed into a very chilly bathroom, can also induce rapid vasoconstriction and an increase in blood pressure, similarly stressing the cardiovascular system. The body's thermoregulatory mechanisms in seniors are often less efficient than in younger individuals. They may not adapt as quickly or as smoothly to these temperature extremes, making the cardiovascular responses more pronounced and potentially more dangerous. The plea here is one of moderation and mindful transition. Avoid extreme water temperatures in baths and showers. Aim for comfortably warm rather than scalding hot. Ensure that the bathroom temperature is not drastically different from the temperature of the water or the rest of the house. Allow the body to acclimatize gradually when changing environments. For example, after a warm bath, sit on the edge of the tub for a few moments before standing, and then perhaps wrap up in a warm towel or robe to buffer the transition to a cooler room. Using a bath mat to prevent slips is also crucial. This awareness of the potential cardiovascular jolt from sudden temperature changes within the bathroom environment is vital. It's not about avoiding bathing, but about creating a safer, more temperate, and less physiologically challenging experience. By minimizing these extreme thermal stresses, seniors can significantly reduce a hidden risk factor for stroke and other cardiovascular events that can originate from this very private daily ritual, protecting their brain by being kind to their body's need for gradual adjustment. Postural hypotension. We now address a specific physiological phenomenon that, while not a habit in the traditional sense, becomes a critical consideration within bathroom routines for many seniors and can be dangerously exacerbated by certain bathroom-related actions, significantly increasing the risk of falls and consequently stroke-related injuries, or even precipitating a stroke through sudden blood pressure drops. Postural hypertension, also known as orthostatic hypertension. This condition is characterized by a significant drop in blood pressure upon standing up from a sitting or lying position. While it can occur at any age, it is far more common in older adults due to age-related changes in the autonomic nervous system, which regulates blood pressure, reduced baroreceptor sensitivity, the the sensors that detect blood pressure changes, decreased vascular elasticity, and the side effects of various medications commonly taken by seniors, such as antihypertensives, diuretics, antidepressants, and medications for Parkinson's disease. The bathroom environment, with its various activities involving changes in posture, can become a high-risk zone for seniors with postural hypotension. For example, standing up suddenly after sitting on the toilet for a period, especially if there has been any straining, which, as we've discussed, already causes blood pressure fluctuations, can trigger a profound drop in blood pressure. Similarly, rising quickly from a warm bath, where vasodilation has already lowered blood pressure, can markedly worsen this effect. The symptoms of postural hypertension include dizziness, lightheadedness, blurred vision, weakness, fainting, syncope, and confusion. If a senior experiences these symptoms upon standing in the bathroom, they are at extremely high risk of falling and sustaining a serious injury, such as a hip fracture or a head injury. A head injury from a fall can directly cause a traumatic brain injury, which may have stroke-like consequences, or it can lead to intracranial bleeding, a type of hemorrhagic stroke. Furthermore, even if a fall doesn't occur, the very significant and sudden drop in blood flow to the brain experienced during an episode of severe postural hypertension can, in individuals with already compromised cerebral circulation due to atherosclerosis, potentially precipitate an ischemic stroke by causing critical underperfusion of brain tissue. While the habit isn't postural hypotension itself, the dangerous habits are ignoring its symptoms, not taking preventative measures, and engaging in rapid postural changes in high-risk situations like the bathroom. The earnest plea to seniors is manifold. Firstly, be aware if you experience these symptoms of dizziness or lightheadedness upon standing. Do not dismiss them as just a bit of a dizzy spell. Report them to your healthcare provider, as they may need to review your medications or investigate underlying causes. Secondly, adopt the habit of changing posture slowly and cautiously, especially in the bathroom. When rising from the toilet or bathtub, do so in stages. Sit for a moment, then slowly push up to a standing position, holding onto a grab bar or stable surface if available. Pause for a few seconds after standing to ensure you feel steady before attempting to walk. Thirdly, ensure the bathroom is made as safe as possible to minimize fall risk. Install secure grab bars near the toilet and in the shower tub, use non-slip mats, ensure adequate lighting, and remove clutter. Fourthly, stay well hydrated, unless fluid restricted for other medical reasons, as dehydration can exacerbate postural hypotension. Discuss with your doctor whether compression stockings might be beneficial. Avoid very hot baths or showers, which can worsen vasodilation. This mindful approach to movement and an awareness of one's own body's signals are crucial. Recognizing the risks associated with postural hypotension within the bathroom and habitually practicing safe, gradual movements can prevent life-threatening falls and the potentially devastating consequence of a stroke or serious injury, safeguarding both brain and body. Medication timing. Our final and exceptionally critical area of focus concerns a bathroom-related habit that might not immediately spring to mind, but carries profound implications for stroke risk in seniors. The improper timing, management, or interaction of medications, often taken in the bathroom, particularly those affecting blood pressure, blood clotting, or blood sugar. While medications are prescribed to manage health conditions and often to reduce stroke risk, e.g., antihypertensives, anticoagulants, diabetes medications, their misuse, erratic timing, or interaction with other substances, even seemingly benign ones consumed around bathroom routines, can paradoxically increase stroke risk. Many seniors have a collection of medications they take daily, and the bathroom medicine cabinet is a common storage place, with morning or evening doses often associated with bathroom rituals like brushing teeth or preparing for bed. One dangerous habit is inconsistency in taking prescribed medications, especially those crucial for stroke prevention. For example, skipping doses of antihypertensive medication can lead to uncontrolled spikes in blood pressure, directly increasing the risk of both hemorrhagic and ischemic strokes. Similarly, erratic dosing or sudden cessation of anticoagulant medications, blood thinners, like warfarin or newer direct oral anticoagulants, DOACs, prescribed for conditions like atrial fibrillation or a history of clots, can dramatically elevate the risk of forming new clots that can travel to the brain and cause a severe ischemic stroke. Forgetting doses or, conversely, accidentally double dosing, perhaps due to memory issues or a complex regimen, can create dangerous fluctuations in drug levels. Another perilous habit is taking certain medications with specific foods or beverages commonly consumed around bathroom times that can dangerously alter their effects. For instance, grapefruit juice is notorious for interacting with a wide range of medications, including some statins, cholesterol-lowering drugs, calcium channel blockers used for blood pressure, and some anticoagulants. Grapefruit inhibits an enzyme, CYP3A4, in the gut and liver that metabolizes these drugs, leading to much higher, potentially toxic levels of the medication in the bloodstream. If a senior habitually drinks grapefruit juice with their morning medications taken in the bathroom, they could inadvertently be overdosing themselves, increasing the risk of adverse effects such as extreme drops in blood pressure, leading to falls or brain hypoperfusion, or excessive anticoagulation, leading to bleeding, including hemorrhagic stroke. Even something as seemingly harmless as a large glass of water taken to swallow pills needs consideration in the context of other habits, like the pre-bedtime fluid overload discussed earlier, if this leads to nocturia, sleep disruption, and subsequent daytime fatigue, which might impair medication adherence or cognitive function. Furthermore, the use of over-the-counter OTC medications or herbal supplements, often stored in the bathroom, without full awareness of their potential interactions with prescribed stroke prevention medications, is a significant risk. For example, some OTC cold remedies contain decongestants, like pseudoephedrine, that can raise blood pressure. Certain herbal supplements can interfere with blood clotting or interact with prescribed drugs. The habit of self-treating minor ailments with these products without consulting a pharmacist or doctor about potential interactions is a hidden danger. The earnest plea to seniors is to adopt impeccable medication management habits. This includes taking all prescribed medications exactly as directed at the same times each day and never skipping doses or altering them without medical advice. Using pill organizers to help manage complex regimens. Having a thorough understanding of each medication, what it is for, how to take it, and potential interactions. Ask your doctor or pharmacist. Specifically inquiring about food and drink interactions for all medications. Keeping an up-to-date list of all medications, prescription, OTC, and supplements, and sharing it with all healthcare providers. Storing medications properly, away from excessive heat or moisture common in bathrooms if not ideal for stability. And critically, never assuming a product is safe just because it's natural or available without a prescription. Always check for interactions. By transforming medication intake from a casual bathroom habit into a precise, informed, and consistent practice, seniors can ensure their medications are working optimally to protect them from stroke, rather than inadvertently contributing to risk through mismanagement or unforeseen interactions. This diligence is a cornerstone of cerebrovascular safety. Ignored warnings. While not a direct physical action performed in the bathroom, a profoundly dangerous habit of mind and behavior that often manifests around health concerns that first become apparent during private bathroom moments is the tendency to ignore or downplay early warning signs that could indicate an impending stroke or a condition significantly elevating stroke risk. This habit of dismissal, of not seeking timely medical attention for concerning symptoms experienced in the solitude of the bathroom or elsewhere, can allow a preventable or treatable condition to escalate to a catastrophic event. The bathroom, being a place where individuals are often alone and engaged in routine bodily functions, can be where subtle neurological or cardiovascular symptoms first become noticeable. For instance, a senior might experience a moment of sudden dizziness or loss of balance while showering or using the toilet and attribute it merely to getting old or a minor dizzy spell, rather than recognizing it as a potential transient ischemic attack, TIA or mini-stroke, or a symptom of significant postural hypotension or an arrhythmia, all of which are major red flags for future stroke. They might notice a temporary weakness or numbness in an arm or leg while dressing after a bath, or a fleeting difficulty speaking clearly while looking in the mirror, but then dismiss it when the symptom quickly resolves. This habit of self-reassurance without investigation is perilous because TIAs are urgent medical emergencies. They often precede a major stroke, and prompt medical evaluation can lead to interventions that prevent that larger, devastating event. Similarly, experiencing chest pain or discomfort, shortness of breath, or palpitations, irregular heartbeats, during or after exertion in the bathroom, like straining or getting out of a hot bath, might be brushed aside. Yet these could be signs of underlying heart disease, such as angina, heart failure, or atrial fibrillation, or potent risk factors for stroke. Even a change in bowel or bladder habits, while not directly neurological, if it's sudden, unexplained, and persistent, warrants medical attention, as it could, in some rare instances, be related to neurological issues or other systemic conditions that indirectly impact stroke risk if left unmanaged. The critical habit to break is the ingrained tendency to rationalize away new or worsening symptoms, to avoid bothering the doctor, or to fear what might be found. This is often driven by a desire to maintain independence or a reluctance to confront potential health problems. However, in the context of stroke prevention, this avoidance can be fatal or lead to lifelong disability. The bathroom can also be where a senior first notices issues with medication side effects, e.g., extreme lightheadedness, suggesting blood pressure medication is too strong, or unusual bruising suggesting an anticoagulant issue, and the habit of not reporting these promptly to their healthcare provider prevents necessary adjustments that could avert a crisis. The urgent plea here is to cultivate a habit of profound self-awareness and prompt action. Listen intently to your body's signals. Any new, sudden, or concerning symptom, especially those classic stroke warnings: FAST, face drooping, arm weakness, speech difficulty, time to call emergency services, or less obvious but still significant signs like sudden dizziness, unexplained falls, severe headache, or visual disturbances, warrants immediate medical attention. Do not wait to see if it goes away. Encourage loved ones to do the same. Replacing the habit of dismissal with a habit of swift, responsible action is perhaps one of the most powerful stroke prevention strategies available. Your bathroom routines should be a time for self-care, not a place where crucial warnings are overlooked. This vigilance is a profound expression of valuing your own life and future. Lack of support. Finally, we must address a broader, often systemic habit that dramatically increases stroke risk for seniors and which frequently comes into sharp focus within the confines of the bathroom environment: the lack of adequate physical support, safety modifications, and assistive aids, often stemming from a reluctance to acknowledge changing physical capabilities or a lack of awareness about available resources. While individual actions are crucial, the environment in which those actions take place plays an enormous role in mitigating or exacerbating risk, and the bathroom is statistically one of the most dangerous rooms in the house for falls, particularly for older adults. A fall can directly lead to a traumatic brain injury with stroke-like outcomes, or by causing fractures and immobility, can create conditions like deep vein thrombosis leading to pulmonary embolism or stroke that significantly increase later stroke risk. The habit we are combating here is one of living in an unmodified, potentially hazardous environment that no longer matches one's current physical needs. For many seniors, pride, a desire to maintain a familiar home environment, or simply not knowing what changes to make, can lead to them navigating a bathroom filled with preventable risks. For example, the habit of not having strategically placed grab bars in the shower, bathtub, and near the toilet forces seniors to rely on unsteady towel racks or soap dishes for support, dramatically increasing the chance of a slip or fall, especially on wet surfaces or when experiencing a moment of dizziness, perhaps due to postural hypotension or a sudden temperature shift, as we've discussed. Similarly, the habit of using a standard toilet seat without considering a raised toilet seat or toilet safety frame can make it much more difficult and hazardous for a senior with knee, hip, or back issues to safely sit down and stand up, potentially leading to straining or a loss of balance. Continuing to step over a high bathtub wall when a walk-in shower, shower chair, or handheld shower head would be far safer is another example of environmental mismatch. Not using non-slip mats both inside and outside the tub or shower is a simple omission with potentially dire consequences. Inadequate lighting in the bathroom, especially for nighttime visits, creates further hazards. The habit of rushing, perhaps due to urinary urgency, which itself might be exacerbated by other habits like late-night fluid intake, in an environment not optimized for safety, multiplies the risk. The plea is for seniors and their families to proactively assess the bathroom environment with a critical eye for safety and to implement necessary modifications without delay. This is not an admission of defeat, but an act of profound wisdom and empowerment, a way of adapting the environment to support continued independence and safety. Occupational therapists can provide invaluable assessments and recommendations for home modifications. Simple additions like grab bars, non-slip surfaces, improved lighting, and appropriate assistive devices like shower chairs or raised toilet seats can transform a hazardous bathroom into a much safer space, dramatically reducing the risk of falls and their devastating consequences, including stroke. Furthermore, for seniors who may need some assistance with personal care, the habit of stubbornly refusing help due to pride when that help could prevent a dangerous situation also needs to be addressed with compassion and understanding. Ensuring the bathroom is a supportive rather than a threatening environment is a fundamental component of stroke prevention for older adults, directly impacting their ability to perform daily routines safely and maintain their well-being. This proactive approach to environmental safety is an essential layer of protection.